Okay, great. So we will go ahead and call the Committee on Health and Human Services to order. Roll call, please.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki?
Here.
Commissioner Dobb?
Here.
Commissioner Anderson?
Present and currently in Pleasant Shade, Tennessee.
Commissioner Killeen?
Right here.
Chair Baker McCormick?
Here.
Have a quorum present.
Thank you. Next item.
B, Chairwoman's remarks.
I have none today. Next item.
C, approval of the October 26, 2021 meeting minutes.
All right.
Move
Is
their
there
approval. I'm seconding Commissioner Anderson's motion.
Thank you. It's been moved and supported. We will do a voice vote. All those in favor?
All right.
Aye.
Any opposed?
Aye.
All right, motion passed. Next item, please.
D, unfinished business. There is none listed.
All right, next item.
Item 1, under new business, an update regarding COVID-19.
And do we have Ms. Baker today?
Good afternoon, Madam Chair Baker McCormick. My name is Carolyn Baker, Chief Operating Officer for the Department of Health, Human and Veteran Services, and I'll be bringing our COVID-19 updates on behalf of our Director, Melita J. Jordan.
Thank you.
Per Commissioner Keeleen's request, I will be sharing the slides today. So can I have permission to share my screen?
Yes, go right ahead.
Okay, is it visible to everyone?
Yes, we can
Yeah.
see it. Mhm.
Alrighty, so I only have 10 slides that I will share today, but let me make it larger. Go to slideshow. Okay, so today's report is for the period of October 31st through November 6th, and I will progress the screen. So as of over the past week, there were a total of 2,833 new cases reported and 9 new deaths. And this is a 36% increase in the number of confirmed cases from the previous week in Wayne County. So the previous week, we had 2,084 new cases, and this is down from the 13 deaths reported as well. So we've increased in the number of cases, but decrease in the number of deaths. And we've been seeing this increasing trend in our cases over the past few weeks. We're averaging 405 new cases per day. Cumulatively, in Wayne County, we have experienced 127, 671 cases, COVID-19 cases, and a total of 2,835 deaths since March 2020. Moving on to demographics. By age, the average age in our database, in our data set is 35 years, 35.8 years. And we've been seeing the most frequent age presenting in our data sets for new cases is 11 years, and we call that the mode. By gender, we're seeing 53% of our new cases are female and 47% male. And this has been consistent over the life of our data since we've been presenting. Okay, I'm gonna come back to the slide. By municipality, the top 5 are reporting Canton Township, Dearborn, Dearborn Heights, Westland, and Livonia. So
How you doing, Jasmine? This is Terrence Adams, customer at Flag Stars.
Terrence, can you mute yourself, please? Thank you.
am I muted? Okay. 8% of the total cases in Dearborn Heights, 7% as well as Westland and Livonia. And I want to mention here, there's still the COVID-19 tables that are going on every 2 weeks with the state, where we share data on Dearborn, Hamtramck, Highland Park, as well as Westland. So we're still sharing best practices on those calls. Okay, I'm trying to progress the slide. Okay, so percent positivity, we have been seeing an increasing trend. So over the past week, our percent positivity among those who were tested is 11.5%, and this is up from 9%, 9.6%, and then 8.9% and 8.6% in Outwayne County. We're seeing similar trends as far as increasing trends at the state level. 13.7% reported over the last period, and then previously 11.6%, 11.3%. We're also seeing a slight increase in percent positivity in Detroit. In the last reporting period, the percent positivity was 5.0%, which is up from 3.5%. And I do want to go back, looking at cases. This slide presents the cases per age group. And just looking at this chart right here, we see that the number of cases reported across every age group has increased over the past week, from October 24th through the 30th through October 31st through the 6th. If you look at the 0 to 4, this has been almost an 80% increase in number of new cases. And this is across all age group 5 to 11. We see almost 100 new cases reported from the previous week, as well as 12 through 18. So just wanted to spend some time on this slide to see where we're seeing the highest number of increases. And it looks consistent across all age group as well. As far as our testing capacity, we over the last period, we tested 4,002, provided 4,002 COVID tests per day. And this is on average compared to the state 3,820, and the city of Detroit is testing about 7,364 COVID tests per day. And we've seen that increases since school opened. Detroit is testing in their public schools. They have mandatory testing twice per week for teachers and students. So we're seeing that has contributed to the increases in their testing as well. So we are still tracking COVID outbreaks in schools. Over the past week, we have been monitoring 7 new outbreaks, and there's been 18 ongoing school outbreaks over the whole course of our tracking. The COVID variants, more than 90% of the confirmed variants in Outwayne County is attributed to the Alpha variant, which is 61% of the total confirmed cases variant reported, and then Delta variant, which is 36%. And we're continue to see an increase in the Delta variant reported over the past week, the previous week, and this reporting week. We've seen 133 new cases reported of the Delta variant for Wayne County. As far as vaccine coverage, we broke this down because November 4th, we began vaccinating children 5 through 11. So our eligible population have expanded by thousands. And we've been working towards hitting our 70% goal that's in alignment with the national milestone for vaccinating communities. And so for those 12 years and older, we did hit the milestone at 72.7% for those who received 1 dose of the vaccine, and then 67% of those that are fully vaccinated. And this is compared to the status behind Wayne County for 1 dose, 64.2%, and fully vaccinated 59.6%, and then Detroit 47.2%, and for those with 1 dose, and then fully vaccinated 39.6%. And this is for 12 and older. Once we expanded the eligibility criteria, our vaccination rate has skewed to those that age group. And now we are presenting both, and we are at 66.2% for those 5 and older with 1 dose, and then 61% for those who are fully vaccinated. We have started scheduling those events, those clinics. We have contacted all of the elementary schools, just as we've done with the middle schools and the high schools, and we have where they will schedule some time, and we are administering vaccines at schools. We are also encouraging parents to take their children to their pediatrician. The pharmacies are also testing. So really looking at a robust strategy where testing vaccination is available at all level of care. So reaching out and making sure that we're sharing the information with the community and parents that we are available to test, as well as their providers. And as far as booster vaccines, we are still providing the booster vaccines here. Our health department has administered 3,668 booster vaccines, and providers for Wayne County, all of the providers combined, have administered 86,067 booster vaccines in Wayne County. So this is the vaccination rate by age group, and we're seeing this dose response kind of a relationship, and it's also aligned with the priority populations that we started with, and we focusing on those who were 65 and older in long-term care and nursing home facilities, and then opening up the eligibility to those 40 years and older, and then those younger population. And we're seeing the 16 through 18 are moving, and week by week they're making inches up towards the vaccination rate, but we still have great opportunities with our school age children. And so this effort to reach the 5 to 11, is fairly aligned, and it should be aggressive in trying to get them vaccinated as well. Okay, so I'll stop there with the presentation, but what I do want to share is that we are still administering vaccines at home. So we still have our program where we are, residents can contact us and we'll visit their home and administer vaccines. Our clinics are open for vaccinating those 5 to 11, and we have vaccines available at our Wayne Health Center in Wayne, Michigan. We also have vaccines available for those 5 to 11 at the Wayne County Community Campus, the Belleville campus, as well as Taylor. And family doctors, pediatricians have those vaccines available for those 5 to 11. We are doing really well with our vaccine site at the airport as well. We're at the North and McNamara Terminal at the baggage claim area, and that has been working out really well, and looking into expanding that effort to other areas within the airport. So this concludes my report.
Thank you. Thank you for your report. Do you have the phone number for anyone who wants to call for a vaccination at home? Do you have the contact number?
Yes, I do.
Okay, if you can give that.
Yes,
so
can I
anyone
drop it in the chat as well?
Sure, that would be
Yes.
great.
So I'll read it. It's 1-866-610-3885, and I will include that phone number in the chat.
Great, thank you. Any commissioners have any questions? Commissioner Vice Chair Colleen, go right ahead.
Thank you, Madam Chair. And thank you, Ms. Baker, for putting up the numbers today. But I do have a request, Ms. Baker, that first, if you can send your charts over to the commission so we have them. And then secondly, you have them in the format of a PowerPoint. I don't know if it's possible or not, or with your IT people, you've got some great slides there that I want to share on social media so that citizens of Wayne County can see the trends that you're talking about. And that's tough to do from a PowerPoint. Is there a way to send these slides so that they would be social media friendly? I don't know if that's possible or not. I'd like to get the data first. And if I can get it in a social media friendly format, that's even better.
Yeah, so I'll definitely send the slides to you that I've shared today. When you say social media format, what format are you talking?
Oh, you got to have like a JPEG file or some other file format, because you can't do PDF. You can't share that. So there are formats that are social media friendly.
Right. So when I share it in PowerPoint, you can save it in JPEG. So it's pretty flexible. Especially PowerPoint can be shared in a picture file. I do want to share that we are working on updating our COVID-19 dashboard. And one area that we've been diligently working is to add the vaccine data. And once that is updated, I will share that information with you, and that's available. So what we want to do is to have data as real time as possible to residents so that you can use it for planning, for evaluation. This data will also have information by municipalities. And we, again, like I said, we are linking to the state database where you'll have, as soon as we get the data, it will be uploaded. So I'm not sure if you, I'll share this, and this has a flexible formatting sort of structure. And then once that is up, I'm really excited to share that with you, and you can post that link so folks can have access to it, because that's what we want.
That's it, data. And okay, I'll leave it with me to figure out the format on my computer and how to do that. But that's fine. We'll figure that out. And if not, I'll call IT. That's what I have for today, Madam Chair. Thank you very much. Thank you, Ms. Baker.
Thank you, Commissioner Colleen. Any other commissioners? Commissioner Anderson.
Thank you, Madam Chair. I just wanted to ask a question about Wayne County employees. Do we have any numbers on how many of our employees are vaccinated? In particular, maybe the locations, but I think it's more important to know how many of our employees are vaccinated.
Yeah, I don't have that number. I don't have that number. I know we are gearing up, preparing for to respond to the OSHA requirements, and we're waiting on MyOSHA. And part of that process is so that, one, we have to identify those who are vaccinated either by self-disclosure, those and now the state has made it available that folks can go online and check out their vaccination information. So we'll be able to access that information. So that will be a key component to be able to identify where the gaps are, where, who are vaccinated, and then who we need to test regularly, and figure out who's vaccinated, who, working from home. It's a whole process to that, but I don't have that number really readily available, and I'm sure as we plan, that will be a key indicator that we need to roll out our plan as well.
Okay, all right, thank you.
Thank you, Commissioner Anderson. Any other commissioners? Just double check here. All right. Well, thank you again, Ms. Baker, for your report.
Thank you.
And we will see you next time. Thank you. Madam Clerk, next item, please.
Item 2, requesting commission approval of a grant agreement with the Michigan Department of Health and Human Services.
Okay, let's take 2 and 3 together, because they're both grants.
Madam Chair, I'll move
yeah.
on both.
Thank you. And any discussion?
Colleen supports the
Any
motion.
questions? Okay, thank you.
Madam Chair,
Yes,
I have a,
Commissioner Dodd.
on either of these, is there a Wayne County match to either of these grants? Does Wayne County have to put any money in?
Hi, this
Not
is,
that I'm aware of, but go right ahead.
yes, Carol Osterberry, Health, Human and Veteran Services, Public Health Director. And no, neither of these are have any match. These are both grant monies that we receive from the state of Michigan for our COVID response activities.
Great, thank you. Thank you, Madam Chair.
Thank you. All right, so any other questions? It's been moved and supported. Can we get a roll call vote, please?
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. All right, we have anyone opposed? Any abstentions? All right, motion passed. Next item, please.
Item 4, requesting commission approval of a grant agreement with the U.S. Department of Health and Human Services.
All right, is there support?
Move for approval.
Support Anderson.
All right, it's been moved and approved and supported. Any discussion on this item? Any questions?
Yeah, Madam Chair, Colleen.
All right, go right ahead. And sorry, I didn't see your hand. And
That's all right,
Commissioner
Madam Chair.
Dodd, it looks like.
Yeah, you're a busy
Mhm.
person when you're chairing on Zoom. So this is CARES Act money? Do I have that correct?
Hi, this is, again, Carol Osterberry, Health, Human and Veteran Services, Director of Public Health. No, this is money directly from the U.S. Department of Health and Human Services. Grant was applied for, and we received for 2 years this award of $3.9 million, $3,919,116 for activities to within the community, raise awareness on vaccine rates, and still in those pockets of our community where those vaccine rates are still low. And it's a community partnership.
Community partnership?
Yes, we have
Meaning-
11 community partners that were all part of the grant application that will be working with and receiving funds through this, is what I'm saying.
Okay, excellent. So this kind of gets at a little bit disparities in healthcare that we see that have been brought into sharp relief by COVID. I think it also touches the social determinants of health a little bit. Is there a larger plan in the health department for dealing with the disparities, the health disparities that we see that have been amplified by COVID? Is this part of a larger strategy for reaching out to minority communities?
You're exactly correct as you described that. This is reaching out using our community partners. There are 9 target communities that were included with this, where we will be working, again, like you're saying, in those communities where we still have the lower vaccine numbers and the higher cases, and identify those communities and the access to vaccine and other healthcare services. You're exactly right. That is why this project the grant was applied for, and it will be a very robust community 2-year project.
Well, I'm glad we're starting down the road on this. There's a long way to go in this area, but I'm glad. Does any of this include anything? Well, describe the outreach. Are we going to get like community nurses going around knocking on doors? What's the outreach going to look like?
Good question. Yes, community healthcare workers. We're working with the community federally qualified healthcare clinics. We are working with Authority Health. We are working, let me get my whole list here. Also with Wayne County Community College, University of Michigan Dearborn, Michigan Community Health Worker Alliance, Access, CHAZ, the Western Wayne FQHC, Alpha Kappa Alpha Sorority, Mario Maro, and the Moses Agency. So advocacy agency, all of those communities are going to be working in partnership with us on this grant, and exactly as we've been stating, to get those resources and information and education out about COVID, vaccines. A big part of this is also to get those vaccine rates in those pockets where we still are seeing lower rates of vaccination.
Well, that's a good group you have there. Is the county going to hire any new employees for this 4 million, or is it all going to be, or are the 8 or 9 partners, are they more like sub-recipients and we're just going to utilize the staff that they have?
A combination of both. Yes, the county is going to hire, especially that, oversight project coordinator, some community health workers, and then most of these new staff will also be hired by these agencies.
Okay. Because I have advocated for community nursing for a while. We used to have more of that goes on. So as this project goes forward and this grant goes forward, I'd be very much interested in hearing from the department the effectiveness of having community nurses go out. We're going to hire some community nurses.
Yes.
Yeah, and so that would be, so that's all within our control or whatever. So we know, but I think I think this is the way to go. You got to knock on people's doors, but I want to be able to show that that's the way to go for future funding too. That we hired 4 or 5 nurses and here was the success rate, and let's get a grant to get 5 or 6 more of them out there based on the success. But I'm delighted to see this grant. Thank you, Ms. Ostaberry.
Thank you, Commissioner.
Thank you, Commissioner Colleen. Carol, is this any way, does this have any impact on Detroit, or is it just only outside of Detroit? Are you working with the health department at all?
We are, yeah, very good question. And yes, the way this was written, it was for Wayne County, but we do have some of those partner agencies are based in Detroit, you know, as the Metropolitan Organization Strategy, Moses, they are in Detroit.
Right.
So it will be work, but we are not working directly with the City of Detroit Health Department.
Okay, great, great. Commissioner Dobb, did you have a question still or no?
Yeah, I just wanted to confirm, no Wayne County funds are going into this program. It's just all from the grant.
That is correct.
Okay, that's all. Thank you.
All right.
Thank you, Madam Chair.
Mhm. All right, any other commissioners? All right, this, I believe we moved in, there was support, a motion.
Yes, we got a motion
Is
for
that
this.
correct? Right, that's what I thought. Okay, so it's been moved and supported. Can we get a roll call vote, please?
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. All right, we've voted on the last item, and anyone opposed item or any abstentions? All right, next item, please.
Item 5, requesting commission approval of the appointment of William A. Phillips to the Detroit Wayne Integrated Health Network Board.
All right, is Mr. Phillips on the line at all?
Madam Chair.
Yes, I am.
I'm Madam
Okay.
Chair, Andrew Candrivas.
Oh, great.
From the Wayne County Executive's Office. Yeah, if I could just kick it off. Mr. Phillips is available. This appointment is to fill the one vacancy we currently have. Just to remind you, there are 6 members appointed by the Wayne County Executive and approved by the Commission. And then there are 6 members of the board that come from the Detroit side of the House to make up the 12 members. So we have one vacancy, and Mr. Phillips is being proposed to fill that vacancy.
Great. Did Mr. Phillips want a few words?
Good afternoon, Madam Chair and Commission. I'm honored to be to have this appointment if approved. I know that mental health is a very serious issue, not only in Wayne County, but throughout the world. And it seems as though the issue is getting larger and larger. So I could commit to you that I would dedicate myself to this board and assuring that the citizens of Wayne County are getting the appropriate services from this organization, and will be available to communicate with you or anybody else within Wayne County as relates to, what our activities are. So if appointed, I'll make sure that Mr. Candrivas has all of my information. He already does, but I will also assure that you guys have my information as well, so that if you have any questions or concerns, then you will be able to contact me and address the same.
Great, thank you. Thank you so much. So is there a motion for approval?
I'll move for approval.
Support.
All right. It's been moved and supported. Let's do a roll call vote, please.
Quick question, Madam Chair.
Oh, sure. I'm sorry. Go ahead, Commissioner.
Thank you.
Mhm.
Thank you, Madam Chair. And to Mr. Candrivas, under the the mental health code, they specify certain slots for the board, primary consumers, secondary consumers. Are we in conformance with the 6 members that come from Wayne County as it relates to the mental health code and what they prescribe for who should be board members?
Madam Chair, if I may, Tiara Winter of Corporation Counsel, who handles this board for Corporation Counsel for the county, is available, and I think that might be best for him to answer.
Yes, good afternoon. T.R. Winter, Assistant Wayne County Corporation Counsel. As I've done with all appointments, we reviewed the entire slate that we have, and yes, we are in compliance with the requirement for primary consumers, family members, or secondary consumers, and substance use disorder. We reviewed those aspects and continue to be in compliance with that.
Well, thank you, Mr. Winter. It's just a little bit of due diligence there, and wouldn't want to trip ourselves up on that one. It's been known to happen. So thank you, and thank you, Madam Chair.
Thank you, Commissioner. Commissioner Anderson.
Thank you. Maybe Mr. Winter or Mr. Candrevis could address, but I seem to remember, was it Mr. Phillips that was name was put forth for an appointment by the administration a few years back, and either the nomination was withdrawn after some concerns, or was that, am I incorrect?
Madam Chair, to my knowledge, that may have preceded my role as liaison to the commission. I may have been in public services at that time. I don't recall Mr. Phillips. I don't recall ever submitting paperwork for him for any other appointment.
Okay. Can Mr. Phillips
Mr.
just
Winter,
answer? Yeah.
Mm-hmm.
I will answer that question. The question was whether I was submitted for another board. Yes, it was the, I believe it was the GLIA board. And the concern actually became my concern because of the amount of work that was going to be required to be on the board. And then I withdrew because of that. I wasn't given upfront the proper allocation of time that was going to be necessary. I have asked that same question for this board, and this board's time commitment is not as robust as that of the GLIA board. That fits within my schedule, both running my company, having a family life, and being a part of this board.
Okay. All right. I just want to make sure I wasn't mistaken as a different person. Thank you.
Thank you, Commissioner Colleen. Commissioner Marecki, did you have a question?
No, I don't. Thank you.
Okay. All right. And Commissioner Colleen, your hand is still up. Did you have another question?
Yeah, well, watch this. Down it goes.
All right. Thank you.
Keep me straight, Madam Chair.
All right. So it has been moved and supported. So let's do a roll call vote now.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
I will abstain. Thank you.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. All right. Looks like the motion has passed with Commissioner Anderson abstaining, and there was no opposition. All right. Next item, please.
Item 6, requesting commission approval of modification 34 to a contract with 3 one-year options to renew with Insight Youth and Family Connections.
All right. This is in my district. Is there any questions on this item? Any commissioners?
Yeah, Madam Chair, I was going for my hand. Oh, there, I found it.
Yeah.
So we have a contract for basically 126,000 to cover their costs of the name change. I guess they got to get all new stationery or something. Do I have this correct? That's what the money is for?
Good afternoon. This is Cecily Hoagland with HHBS, Juvenile Youth Service Division. No, this is their third quarter adjustment. We couldn't put the third quarter adjustment through because of their name change. And now that we got the name change, we can put the third quarter adjustment.
Gotcha. Thank you very much.
You're welcome.
I'll move its approval, Madam Chair, if nobody has already.
Thank you. Is there support?
No support.
All right, it's been moved and supported. Roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. Motion passed. Is there any abstentions or opposition? All right, next item, please.
F, such other matters as may be properly submitted before the committee.
There are none. Next item.
Public comments.
All right, is there anyone in the public that has a comment? Anyone in the public?
Sure.
Everyone looks like they're unmuted, and we have a Mr. McCormick. You have a comment, and just to let you know, we don't exchange comments. We just listen to what you have to say.
Okay,
Go
I'm
right
glad
ahead.
that, thank
How
you
much
for the
time, Madam
opportunity.
Chair?
2 minutes, 2 minutes. Mhm.
Thank you for the opportunity to address the board. The data that was presented at the beginning of this meeting is further evidence that masks and vaccines do not work. The masks especially are not working. This board continues to discriminate against children. It continues to treat children as second-class citizens and property of the state. Our children are not the property of the state. They're God's creation. The state does not own our children. The school boards do not own our children. And this board does not own our children. And the fecklessness of this board is brought into further relief by the new member who said that mental health is such a huge issue. This board is contributing to the mental illness of our children. Suicide rates among teens are skyrocketing, and there's no conversation on this board about mental health, about the teen suicide rates that are skyrocketing, according to the CDC, and there's no conversation. It's all about COVID because that's where the money is. It's obvious to me that this board cares nothing about the health of our children. The board only cares about continuing its power and its ability to repress children, to mute them, to silence them, and to take them away from their parents. I would hope that this board would look internally and take a look at the real effect of its policies on the children of our community. If you do truly care about their health, you'll unmask them, you'll allow them to speak freely, you will allow them to continue to learn, and actually recognize the skyrocketing depression and suicide rates among children in our country that are born about specifically from bureaucrats like yourselves. And Mr. Colleen, you don't need an IT program or an IT department to change a PowerPoint slide to a PDF or a JPEG. It's indicative of further ignorance. It's unbelievable to me. It's no wonder our taxes are so high. Goodbye.
All right, is there any other public comments? Any other public comments?
I would like to make a comment.
I'm sorry, your name? I didn't hear you.
This is Linda Cicciatti. I'm in Wayne County, and I would just like to reiterate everything the gentleman said just now preceding me. I am totally in support of removing masks from children, making that optional, and making sure that students are not required to take tests or sit in different places. Science has not warranted the treatment they've been receiving, and I am gravely concerned for their physical and mental and emotional health due to this required masking of students. So thank you. I don't need the full 2 minutes, but I do appreciate your time and listening.
Thank you. Any other public comments? Any other public comments? All right, Madam Clerk, did we get any emails?
I do have an email from Billy Schultz. I see that they are online if they would like to speak instead. They also just wrote in the chat. So Billy Schultz, if you're on the line, you can speak if that's what you wanted to do.
Am I on? I don't know.
Yes,
Can you see
yes,
me?
we can
Okay.
hear you fine. Go right ahead, Ms. Schultz.
Okay.
Mhm.
All right. Good afternoon. My name is Billy Schultz. I have two girls that are a freshman in high school. We do not want vaccine clinics or vaccine mandates in our schools. Medical decisions need to be left up to the parents and minor child. The school boards and government do not have the right to make medical decisions on our minors. If these mobile clinics come into my child, I will be forced to pull my kids out of public schools and homeschool them. Unmask our kids. Sending our children with or without a mask needs to be up to the parents or legal guardian of the minor child. We need to stop unnecessary quarantines and testing on healthy children. 99% of the quarantined children do not become positive. The courts are finding these quarantines unlawful. There has already been 15 cases that have been won so far in the court system here in Michigan. CRT needs to be removed from all of our schools here in Michigan. Parents are not domestic terrorists. We are the parents who care about our children and education and well-being. Legislation 38, Guardians' Duties of Public Schools. Section 10, it is a natural fundamental right to determine and direct the care, teaching, and education of our children. The public schools of this state peoples by cooperating with the people's parents and legal people's intellectual capabilities, vocal skills, and a safe environment. Thank you.
Thank you. Is it Miss Sydney?
Yeah.
Miss Cindy?
Yeah.
Mhm. Yes.
Can you hear me?
Yes.
I'm looking at the Michigan Department of Treasury website. And when I look at the website, and it talks about the American Rescue Plan Act and the money that Michigan received. When I go down to, in this document, when I go down to the part where it says application requirements, beneath there, it says award terms and conditions agreement. So this is from the government. And when you go through the terms and conditions of the agreement, number 15, the disclaimer says, the United States expressly disclaims any and all responsibility or liability to the recipient or third persons for the actions of a recipient or third persons resulting in death, bodily injury, etc. My question is, everybody is talking about how we want to implement these vaccines, and I am seeing horrific things in VAERS, the vaccine adverse event reporting system. There's a lot of events in there where children are either being maimed or they have been killed by this vaccine. I want to know who is responsible here, because the government is not. So which one of you are, or is the school responsible? We need to know this information, and it needs to be publicized by Wayne County so we know who to go after if something happens to our children.
Thank you. Is it Robert?
Good afternoon, everyone. Robert Pulaski here, calling in from Southgate and Wayne County for the record. I'd just like to reiterate what Billy and Matthew have been talking about. Unmask our children. It's really unnecessary. We've been at this for 2 years now, and I really find it really, they have no say in what they do anymore. Either you go into a school and you get complaints for masks every day. I am a student at Southgate Anderson High School in Southgate. I cannot tolerate this anymore. I'm getting sick and tired of being told by the government what I can do with my life. I'm getting tired of it. This needs to stop. The tyranny needs to end. And we need to get people, let's take a stand. We cannot take this anymore. Let's fight back and let's ban these mandates for good. The Wayne County Health Department, you've always had my respect and you always will. I just ask today that we please end these mask mandates for good and have our freedoms back. Thank you for the time and opportunity to speak.
Thank you. All right, any other public comments? All right, Madam Clerk, do you have any emails that you received?
Just the one.
Okay, great. All right, thank you. Next item, please.
Adjournment.
There a motion?
Move to adjourn.
All right.
Or
Thank you. You all have a good rest of your day.
Thank you, Madam Chair.
You too.
Okay.
Have a good one.
Bye.